Hello, everyone, and thank you for being here. On behalf of our group, we are excited to share our community health assessment and intervention strategy. When we look at public health, it's easy to get lost in the spreadsheets, the data, and the broad statistics. But at its core, community health is about people. It's about understanding the unique barriers our neighbors face and finding sustainable, actual ways to close those gaps. Our team spent weeks analyzing the current healthcare landscape of our targeted region, Hood County. We looked closely at resource distribution, primary care accessibility, and the specific socioeconomic factors that impact long term patient outcomes. What we found was a compelling case for targeted, community driven intervention. Today, we're going to break down our findings in three key areas. First, the data and the immediate needs we identified. Second, our strategic framework for addressing these disparities. And finally, we can measure the success to ensure this project creates a long lasting, meaningful change. Edited by Autumn Rodriguez, Jennifer Curry, Morris Smith, and Validia Alvarez.
The community health need that we've selected and identified is the disparity in primary care physician to population, with approximately only one primary care physician to 2,200 residents in Hood County. Additionally, 16.2% of residents under the age of 65 are uninsured, creating financial barriers to accessing primary care services and contributing to poorer health outcomes. Healthcare need in Hood County, we analyzed data from several reliable sources, including the County Health Rankings and Roadmap, the U.S. Census Bureau, and other public health resources. When reviewing the data, one of the biggest concerns we identified was the shortage of primary care providers. Hood County has a higher provider to population ratio than both the Texas and national benchmarks, meaning there are fewer primary care physicians available for the number of people who need care. This can lead to longer wait times, reduced access to preventative services, delayed diagnoses of chronic conditions, and increased use of emergency departments for healthcare needs that could have been managed in a primary care setting. We also examined insurance coverage and found that a significant percentage of Hood County residents under the age of 65 are uninsured. Adults in this age group often do not qualify for Medicare, and many either do not have employer-sponsored insurance or cannot afford private coverage. Without insurance, many people delay routine checkups, preventative screenings, and treatments because of the cost, which often results in poor health outcomes and more advanced illness by the time they seek treatment. By comparing Hood County's data to state and national benchmarks, we concluded that the combination of limited access to primary care providers and a high insured rate presents a significant healthcare disparity. These findings clearly demonstrate the need for strategies that improve access to affordable primary care and expected healthcare resources within the community. Of this need. The shortage of primary care physicians relative to the population limits access to preventative and routine health care. This, along with underinsured individuals, is contributing to poor health outcomes, delayed diagnosis, and increased rates of chronic disease. If this disparity is not addressed, the long term effects on Hood County could be significant. A shortage of primary care providers means residents have less access to preventative care, causing chronic diseases like diabetes and hypertension to worsen over time. At the same time, a high number of uninsured individuals often delay seeking care because of cost, which can lead to more advanced illness by the time they receive treatment. These factors increase emergency room visits, preventable hospitalizations, and overall healthcare cost. In the long run, this can contribute to poorer health outcomes, shorter life expectancy, reduced workforce productivity, and a greater financial burden on both the healthcare system and the community.
Let's take a look at the numbers because the data tells a very clear story. Right now, the primary care provider to population ratio stands at a staggering 2,770 to 1. Think about that. One single primary care doctor tasked with managing the health and well being of nearly 2,800 people. When a community faces that kind of provider shortage, preventive care suffer, wait times skyrocket, and routine checkups become a luxury. But the shortage of doctors is only half the battle. Compounding this issue is a significant financial barrier. 16% of the local population of Hood County is completely uninsured. That means nearly 1 out of every 6 individuals in this community is navigating a severe shortage of doctors without a safety net. When you combine 2,770 to 1 provider ratio with a 16% uninsured rate, you get a community forced to rely on emergency departments for basic healthcare needs, and that's exactly where our intervention framework steps in.
There are a number of contributing factors that contribute to the shortage of primary care physicians and specialists within rural counties. Hood County is close to the Metroplex, so many people choose to live in Hood County because the cost of living is cheaper, and then they commute into the Metroplex. Increases the growth of population, and it makes it so the infrastructure for the healthcare system can't keep up. This puts a heavy burden on providers that cause them to burn out because they're so overwhelmed with the amount of patients that need to be seen. So they quit, or they move away to a less populated area, or they simply retire. According to the Cicero Institute, 45.2% of medical school graduates leave Texas to practice in either their hometown or elsewhere. Another factor is more providers are choosing to practice in larger cities for more diverse professional opportunities. With that rapid growth and the growing number in the older population, they have more complex issues that add to the demand for more healthcare providers that just simply aren't available. There are so many barriers to healthcare, transportation being a huge one. Patients either don't have a car, can't afford to put gas in their car, or are unable to drive due to disabilities such as age or poor health. We also see many that need to see specialists but can't find one that are close to them geographically because many are out of network with the patient's insurance, so they have to drive further to be with the provider or specialist that is in network. And therefore they go without seeing a specialist because they can't get there and they deny themselves the medical care they desperately need. Then there's the financial aspect causing major barriers as well. People either don't have insurance, they're underinsured, or the copays and deductibles are so high it becomes unaffordable. They have to make a choice between, do I pay for my food, rent, utilities, or do I get medical care? And sadly, many times medical care is the last thing that they will choose. target populations that appear to suffer the most and would benefit from interventions or assistance are older adults that have chronic diseases such as heart disease, COPD, diabetes, and other chronic issues such as heart disease, just to name a few. We also have pregnant women who need routine prenatal and then postpartum visits, and they go without prenatal visits because they just can't afford it or they can't get to it. We also have kids and adolescents that need well child exams and immunizations, and for whatever reason, they can't get in to be seen to get those well child, and the immunizations might not be covered by their insurance. We also have the rural population that lives so far away that driving long distances to see a PCP, let alone any specialists that need to see them, it just becomes too hard. We also have those that face financial constraints, such as a low income, people who don't have insurance or not enough insurance. They put off health care because they can't afford it. They have to choose to be able to survive versus taking care of themselves. And finally, but definitely not last, is a population that requires close monitoring of chronic issues such as diabetes, cardiac issues, high blood pressure, COPD, and cancer. These things really need to be monitored closely, especially with diabetics and the high blood pressure, because if it goes untreated and unmanaged, it could lead to so many other issues. And then that would just be even more of a burden that the patient would have to deal with as well.
Activities and interventions. For our first intervention, we use mobile medical vans to bring healthcare directly into underserved and rural areas of the county. These mobile clinics can provide basic checkups, treat minor illnesses, offer the preventative care, and determine if patients need to be referred for further treatment. This helps people who may not have the transportation or who live too far from a primary care provider. Think of it as healthcare on wheels. Instead of waiting for people to come into the clinic, we're bringing the clinic to them. It's basically an Uber, but instead of picking you up, we're checking your blood pressure. We would also continue using telehealth resources in schools such as T-Chat. This is given to the children and adolescents better access to mental health services without having to travel long distances. This allows students to receive support sooner and can improve both their health and success in school. Our second intervention is partnering with local healthcare providers and community organizations to offer free healthcare screenings. These screenings would include blood pressure, glucose, BMI, and cholesterol checks. By identifying health problems early, people can receive treatment sooner, which may help prevent more serious complications and reduce healthcare costs for them. Now let's be honest. Most people don't even realize they have high blood pressure until that cuff is squeezing that arm and the nurse gives them that look. Catching these problems early gives the people the opportunity to make changes before they become medical emergencies. The third intervention is setting up pop-up vaccination clinics throughout the community. These clinics could be held at schools, churches, community centers, and local events to make vaccines more convenient and accessible. Increasing vaccination rates helps prevent both individuals and the community by reducing the spread of preventable diseases. And if we can offer vaccines where people are more already gathering, there's one last excuse of, I was gonna get to it, I just didn't have the time. Because we know life gets busy. Our final intervention is partnering with organizations such as Kin Health Center to offer educational workshops. These workshops would cover topics like diabetes nutrition and management, heart-healthy lifestyle choices, and mental health awarenesses. Providing education gives community members the knowledge and resources they need to better manage their health and make healthier choices every day. Because let's face it, Googling your symptoms at 2 a.m. usually ends up with you thinking you have 3 rare diseases and 6 months to live. Community education gives people reliable information from healthcare professionals instead of the internet's worst case scenarios. In the end, these interventions are all focused on improving access to care, preventing the disease, and helping people stay healthier before they end up needing more expensive or emergency treatment.
There are several funding sources that help mitigate the primary care physician shortage. HRSA, Rural Health Grant, the Federal Health Resources and Service Administration has multi-million-dollar funding opportunities specifically focused on rural health infrastructure. The Health Resources and Service Administration role is addressing rural health care challenges such as provider shortages, limited infrastructure, long travel distance, and chronic disease burden. The main focus is Rural Texas Strong. Texas Rural Health Transformation is a program which includes 6 initiatives. The first initiative is Prevention and Wellness Program. This targets chronic diseases like diabetes, heart disease, respiratory illnesses, and obesity. The second initiative is the Consumer Face Health Portals to improve patient engagement and health information exchange. They also are developing AI and telehealth investments to expand the access, improve care efficiencies. The rural workforce development, including career pathways into the medical field, scholarships, bonuses, and residency fellowship programs to increase the PCP population. They also working on cybersecurity and unified health infrastructure, capital and equipment investments for rural hospital, clinics, EMS, behavioral health providers, pharmacies, and public health offices. This document also has several Texas rural related programs. That's the County Indignity Health Care Program. Provides basic health service to low-income residents who do not qualify for Medicaid or other programs. Texas Rural Hospital Innovation Grant Program supports several rural hospitals and districts with projects that improve care access, quality, financial stability, and facility sustainability. We've got the Sid Richardson Foundation. It offers funding to nonprofits in healthcare, education, human services, and the arts, including health-related projects such as clinic, hospital capital improvements, technology upgrades, health education, and services for low-income populations. Overall, it emphasizes improving the healthcare in rural areas, strengthening rural health workforce, and upgrading infrastructure and expanding technology to support underserved Texans. No single organization can close the primary care gap alone, so our plan leans on a network of local partners who each bring something different. Here is how each one contributes. Lake Granbury Medical Center is our central clinical anchor. It provides emergency backing and, just as importantly, a primary care referral pathway so that high-risk patients we catch during community screenings can be connected to ongoing care rather than falling through the cracks. The Hood County Public Health Department supports us with public health nursing oversight and clinical data tracking, and supplies the educational material we hand out at fairs and workshops. Their data role also helps us measure whether the interventions are working. Local rural churches and community centers give us trusted, accessible, and completely free sites to set up portable screening stations because residents already know and trust these places. They lower the barrier to walking into the door, especially in outlying parts of the county. Finally, the Weatherford College of Nursing programs supply a capable workforce of nursing students To staff local clinics and hospitals, this adds hands to stretch providers and over the long term helps build a pipeline of clinicians who choose to practice in the community.
Nurses and community involvement. One nursing intervention that could realistically be implemented within a year is organizing free community health screening events. Nurses can provide blood pressure, blood glucose, cholesterol, and BMI screenings while educating community members about a healthy lifestyle choices. If someone has abnormal results, they can be referred to a PCP for a follow-up before a small problem turns into a much bigger one. I think this intervention is a great option because it's cost effective, fairly easy to organize through partnerships with local healthcare providers and community organizations, and it helps catch health concerns early. As nurses, we all know that prevention is usually much easier and a lot less expensive than treating advanced diseases. To make these events successful, we could recruit retired or part-time physicians, nurse practitioners, and nurses to volunteer at community clinics like the Ken Hill Health Center. Their experience would allow us to serve more people without significantly increasing cost. We could also partner with community health workers and local organizations such as Rancho Brazos Community Center to help them with community outreach, health education, and connecting residents with social services. They already have trusted relationships within the community, which can encourage more people to participate in these type of events. Another resource would be volunteer groups like the Lake Granbury Medical Center Auxiliary. They could assist with non-clinical tasks such as registration, directing patients, managing paperwork, and helping the event run smoothly. This allows nurses and providers to spend more time caring for patients instead of worrying about the logistics. And let's be honest, a lot of people, they think that they're perfectly healthy until their blood sugar comes back higher than their favorite dessert. Suddenly they're asking, so what exactly counts as a carbohydrate? Plus, who doesn't love free? If there's one thing people love more than free samples at Costco, it's free healthcare screenings. In all seriousness, though, these events can make a big difference by increasing access to care, educating the community, and helping people get the treatment they need before their condition worsens. By working together with healthcare volunteers, community organizations, and hospital auxiliary groups, we can reach more people and improve the overall health of Hood County.
These interventions are expected to move Hood County closer to state and national benchmarks over time. Here's is what we anticipate each effort will accomplish. Increase health education. The chronic disease self-management workshops and health fairs will give residents practical tools for managing diabetes, hypertension, heart disease, and COPD, and help them recognize when to seek earlier rather than waiting until conditions become acute. Improve access to healthcare. Mobile medical vans reaching outlying areas and telehealth programs such as TCHATT in the school districts directly address the transportation and distance barriers we identified, bringing basic checkups, acute care, and triage to residents who otherwise go without. Reduce disease prevalence. Earlier and more consistent contact with care, combined with prevention and wellness efforts, should lower the rate of preventable chronic disease complications and support earlier diagnosis for at-risk residents. Increase community engagement. Partnering with trusted local sites such as churches, community centers, and organizations like Rancho Brazos Community Center, Ken Hill Health Center, builds ongoing relationships and encourages residents to participate in their own health. Increase screening rates. regular health fairs offering free blood pressure, blood glucose, BMI, and cholesterol screenings backed by a referral pathway to Lake Granbury Medical Center will catch high risk patients sooner and contact them with primary care providers. Increased vaccination rates. Drive-through and pop-up immunization clinics at schools, churches, and community centers ahead of flu season will make vaccines convenient and accessible, raising coverage across the underserved population.